Hi there, this is Marielle Concepcion, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is access, comfort, and convenience, and simplifying and improving things in order to provide the best care possible for my patients. I am Dr. Lauren Hughes of Bloom Pediatrics and Lactation, and this is my DPC story.
Speaking with Dr. Hughes was such a joy. While I was tempting my own son with multiple Disney movies, Dr. Hughes was on the other end of the interview line with both of her 7-month-old twins and her 3-year-old son. Listening in on the toddler and infant involvement in the pod as well, very 2020. On that 2020 note, there are a few glitches that occurred during the recording where there is overlapping conversation. I edited out as many as I could, so please remember this is 2020 and try to listen with an open state of mind today. Now, let me introduce Dr. Hughes. Dr. Hughes completed her undergraduate education at Pittsburgh State University and went on to the University of Kansas for medical school. During her time there, she helped establish the KUMC branch of Exercise is Medicine. She graduated from medical school in 2017 and was 36 weeks pregnant when she walked across the stage. After graduating from medical school, Dr. Hughes did her pediatric residency at the University of Kansas Medical Center, where she worked at both KU and Children's Mercy Hospital. Dr. Hughes obtained her IBCLC designation during her 3rd year of residency. She graduated from residency in July of 2020. She is a member of the Academy of Breastfeeding Medicine, the Midwest Direct Primary Care Alliance, and the National Direct Primary Care Alliance. Welcome to the podcast, Dr. Hughes. It's great to have you on. It is so unique that you are a practicing pediatrician as well as an IBCLC. I wanted to start our talk with how did you first learn about DPC?
I first learned about DPC my intern year of residency. I was doing what all interns do and trying to figure out what I wanted to do with my life, and was scrolling through Facebook as I am a millennial, and saw a post in my physician mom group of Kansas City by the owner of Health Suite 110 in Overland Park, Kansas. And she talked about her direct primary care clinic. So, which led me to Googling what is direct primary care, and kind of led me down the rabbit hole. Found DPC docs on Facebook and realized like, this is what it was. This is what I wanted. I had been trying to figure out how could I work outpatient and have time with my patients, and not have to see 30 patients a day and chart for 2 hours every single day. And I mean, DPC just checked all the boxes.
That is so amazing that you were able to find out about the movement so early on. There are definitely a lot of people learning about the model after residency, but for you to have learned about it and decided very early on in your training that that's what you were going to do after training, what a wonderful way to drive your clinicals and to drive your experiences. I hope that somebody out there, or more than one person, is listening to your story to also get that
it was great
because
I was able to tailor my electives to, okay, I need more exposure to derm or cardiology or GI or whatever it was. I could get that exposure and I could tell them, hey, I'm going to be solo private practice. Like, I've got to figure this out. We have like, what needs to come to you? What's an emergency? What are you comfortable with me managing? So it was a really nice way to tailor my education, and really get that exposure, and also get cell phone numbers of specialists that I now have access to. Wonderful.
You don't necessarily think about in residency, who are you going to talk with or ask advice of later on. I think as a family medicine doctor, I only really thought about that in my third year when, things were getting real and jobs were about to happen after residency. And so that's fantastic that you had, again, that strategy in place of this is what I want to do so early on. After you had learned about the movement and you decided that you were going to open your own DPC clinic, when did you decide on the name for your practice? And how did you strategically plan your practice in preparation for opening after residency?
My husband actually came up with the name. He said, you're blooming as a resident, and the kids in your practice, they're growing up and they're blooming. So bloom was just a nice representation of all of that, of the development of kids and myself in this practice. So the name worked out really nice. And I just liked it. And what I had envisioned originally was just, before I became a lactation consultant, I had just kind of imagined that I would just be able to do care and have time. And that was the big, saying that I had imagined, was that I would have time and I would not be burdened with the bureaucratic boxes and meaningful use and Press Ganey and all of those extra things that you have to be inundated with as a practicing physician. So what I just imagined was just simple medicine. So my dad is a family doc in our small town, and it was, people got stitches on our kitchen table, and it was very, he used to get, whenever he was in private practice, someone paid him in chickens and fruit, so that was what I'd grown up seeing, was that this was what medicine is. And it's this, you just take care of patients. And then when I went into residency and I saw what it's become with just kind of excess, unnecessary things, I knew that that's not what I wanted. I wanted to practice more old school medicine like my dad. And so that's kind of what I'd envisioned. And then as I got closer to it actually becoming a reality, then it was, okay, what do I want my space to look like? And as I became in IBCLC, then it was, how do I incorporate breastfeeding medicine? And so I was able to, it evolved with me throughout residency.
How did you go about designing your logo?
So I had the original design. I did that. And then I had someone on Etsy kind of pretty it up.
It's a beautiful logo. And it really, you look at it, and bloom is definitely one of the words that comes to your mind, even if you didn't read bloom. So what about your website?
That was something that I worked on for quite a while, just going through and making it look exactly how I wanted. I used Squarespace, and I just Googled a lot of code to make it look how I want it.
In 2020, that's something that anyone who has that interest and drive is able to do easily. I mean, I think that's so empowering for you to not only develop your practice, but even to the point of developing your practice where patients are going to make their first touch with you. So that's fantastic. And you did a great job. I love the layout. I love the colors. I love how everything goes together. And especially now that you have the video of yourself right when you pop up the website and you are explaining Bloom Lactation and Pediatrics. I think that is not something common that you see on any fee-for-service.
And so
website.
that actually, I created that video. I did a new mom event last month, and they wanted kind of an explanation video. So that was kind of the push I needed. I just made it. I had originally made it for that. And I was like, this is really helpful, and people don't necessarily want to go through a website and scroll and read. So I was able to make the video that I think does a good job of explaining things rather than having to write a huge long paragraph about it.
Yeah, and it's so personable because it's you explaining the value and the practice. I mean, when people are looking for accessible care and they see their future doctor saying, you don't have to go to 4 different visits or specialists to get care when you could see me and I can even come to your house. That's just so reassuring for a parent who is wanting that type of service. How has it been since opening your doors?
My doors are not technically open yet. So COVID has really thrown a wrench into my physical space opening. I've been waiting for a permit to be able to be in my clinic for 3 months, and I still don't have it. They had to furlough a lot of the city workers. Everyone's working from home, and there has been just a lot of delay in getting the things that they need. So it's been difficult in that sense. I have my entire clinic sitting on my kitchen table, essentially. So I've been just doing exclusive home visits, which that has been a really cool experience because I'm able to see kids in their environment. And that, like if you have a new crawling infant and there's where I come and see you and there's cords on the ground or something, we can talk about baby proofing.
What an experience then for you to be able to do that, especially right now exclusively, although not planned. Because yes, I mean, the way that the fridge is stocked, the smell of the home, how many steps it takes to get into a person's house, how many siblings are there, and just general cleanliness of a place, or how a house is just set up. I mean, that it is such a different experience to see someone in the clinic versus in their home.
So I will continue doing home visits for certain patients. So like my newborn and 1 month well child checks, home visits are just included because it is hard as a new mom to do. No one wants to have to pack up a car seat, and you yourself are still in diapers, and like everything is just hard, and you probably haven't slept. So I include that in my fee, that you can have those visits be at home. And then outside of that, they can, if they're in the clinic side, then they can pay to have additional home visits, if car broke down or it's snowing or something like that. And then I also have options for patients to exclusively be seen at home. It's just more expensive.
And I think you make that very clear on your website in terms of Bloom at clinic and Bloom at home. And it allows parents or guardians to make that decision with whatever they're comfortable with. Earlier, you had mentioned that you had learned about DPC in part by the Overland Park DPC. And during this last DPC summit, you had also mentioned that you had made contact with Dr. Allison Edwards from Kansas City DPC. Can you tell us about how you came into contact with Dr. Edwards?
So she was recommended in more than one way. So some of my attendings, once I discussed that this is what I want to do, they went to med school with her. And so they knew what she was doing. I was told from a couple of attendings, oh, you should talk to Dr. Edwards. And then, of course, Dr. Edwards is kind of a bigger name in the direct primary care community. She is on the board for the DPC Alliance. So she's she's very well known just in Kansas City in general. So was able to reach out to her and say, you know, this is what I'm interested in. And can I just ask you questions? Because, you know, in med school, no one gets taught how to run a business or what you need to run a business. You know, if you join a practice, people have how your med mal picked out for you, and you just have to sign that. You don't have to figure out, okay, what forms do I need? What legally do I need to have set up? Who do I talk to legally? How do I find an accountant? How do I find a space? All of these things. And so there's a lot more than just being a doctor that goes into starting a practice. And so she was a great resource for just finding people or telling me what I needed. You know, that this is how you get started. So she was great in that regard. And then we also had the same loan in med school. So we both went to KU, and we were recipients of the Kansas Medical Student Loan Program. So the KMSL is a loan program that the state of Kansas does where they will pay you a stipend and pay your medical school tuition if you work in an underserved area in Kansas. So that includes Wyandotte County, which is Kansas City, Kansas. And so then so that was also the same county where I went to med school and did my residency. So I was able to talk to her about that. You know, how does it work if you don't have an employer and and I'm self-employed. And so it was just a lot of logistical things that she was just fantastic in terms of being a resource for.
That's wonderful that you had that mentorship with Dr. Edwards. And it's really nice to know that you have someone local in your state who was able to give you that financial advice with regards to the loan repayment too. Beyond direct primary care, you're also in partnerships with specifically Raising Littles and Oh Baby.
So I have two different partnerships. So I have one with Oh Baby KC, and that is owned by someone named Mary Pope. So she is a doula and is wonderful. She was actually one of the very first people that I ever talked to outside of like my residency people and my family. And about Bloom. And that was a couple years ago. And, you know, I wanted someone's perspective of, what do you think about this? Would anyone want this? Would anyone pay for this? So she has been kind of cheering me on for the last couple of years. So my thought with partnering with doulas is, it is a really nice way to work together. Doulas are fantastic support throughout pregnancy and through delivery. And she also provides postpartum doula care, which is the coolest thing that I did not know existed. And that is, you have someone that can come in and help with breastfeeding. They can make dinner. They can wash dishes and wash bottles. They can hold the baby while you sleep. They can help you do chores or whatever you need in order to function after you have a baby. They can come in and help do that. They can stay overnight. They can do whatever you need. And so that pairs really well with my practice, because those are the people that they want more personalized care and more access. So we did a partnership with my 4th trimester package, where I offer just that really intense 4th trimester care where, you know, that's where most questions are coming from. And are they growing? Are they jaundiced? Are we having issues? So we did a partnership with that. Because it works really well, especially with that postpartum care. And then we also work together in terms of, once my clinic space opens, my lobby will be used for her to film and do socially distanced education classes. So they do like labor classes, childhood, like birthing classes, like prenatal things. She does all kinds of education. So it'll be a really nice place for her to work. And then for me on the pediatrician side, it's a nice way to get pregnant families, pregnant moms and their families into my clinic and see what I'm about and the access that they could have.
That's fantastic that you have that offering paired with your practice. Boy.
And then my partnership with Raising Littles, Marnie is a gentle sleep coach, and that it just with how I practice and how I mother, it just worked really, really well. So many times, anyone from, okay, newborn, they only sleep on me, to, okay, 4-month sleep regression, to 9-month sleep regression, to 18-month sleep regression, to my 3-year-old won't get out of my bed, to how do I transition from a crib to a toddler bed? What do I do about frequent wake ups, or whatever it is? I like, you learn the basics in medical school and residence, or in residency. You learn, like, okay, we can talk about sleep hygiene. I can tell you how to manage night terrors. We can talk about putting them down drowsy but awake. But my experience and my knowledge is limited. That's not my area of expertise. Just like I wouldn't pretend to be a speech therapist or a physical therapist. Like, I'm not a sleep expert. So having someone that I can work with, that I can refer patients to, and we go both ways, where we offer discounts for members of each other's practices. It's really nice for me to have someone that I can say, hey, you're having trouble with sleep, here you go. And I've been able to network with so many amazing professionals just in Kansas City, in terms of mental health therapists and people that specialize in like postpartum and parental anxiety, to people that with birth trauma, and then with like other forms of therapists, like speech therapists and physical therapists and occupational therapists, and other IBCLCs, like all of these professionals in Kansas City. This practice has really opened up my ability. I didn't know this existed. And so I've been able to meet incredible people and really create this strong network to support families.
It's not easy to find that type of care in whatever community you're in. I'm in rural California, where that type of care is just unheard of. And so that's great that through working in these partnerships, you're able to develop that network to make a stronger community for all of the kids who are, involved in your practice and their practices. I want to ask, is Marnie doing care via virtual visits right now during COVID, or is she going?
She is doing all virtual care right
homes
now
to talk with parents, or both.
And she does it everywhere. So she's able to see anyone anywhere, which is really great.
You also offer circumcisions and sternotomies. Can you touch on your training for those procedures, and do you have an assistant?
For circumcisions, one of the parents just have to provide the sweeties, which is the sucrose water that patients it's kind of like a little baby sedative. It just is very calming to infants whenever they use sucrose. So parents do that, and then I just do the circumcision. I have a board and everything that I'm able to do in their home. Then with sternotomies are very easy in the sense of that I can just have them lay on the ground, but I just kneel down over them and I'm able to do the clip. It's a 10-second procedure. So it's not a hard thing for me to do without assistance. So I learned about circumcisions. We do them in residency in our newborn nursery and in our NICU. So I've done lots of circumcisions. We have a pretty high volume labor and delivery at KU. So I've been able to do a bunch. I'm very comfortable. I do a GOMCO method for circumcision. So I'm lucky that my residency has the pediatricians do that, and I was able to learn that procedure. The tongue tie was a little bit different. So there's different types of tongue tie. There's anterior and posterior. Evidence is very limited on the posterior side, borderline non-existent. It's currently happening right now, but we don't have a lot of like long-term study peer-reviewed things for posterior tongue tie, but it's coming, and we know that it exists. So I do a scissors sternotomy. I learned how to do anterior ankylosing repair also in residency, or sternotomy, not repair. Also in residency, in our nursery, we were able to do those very easily. So I've gotten very comfortable with that. Then the posterior side, I learned by working with breastfeeding medicine physicians, and specifically an ENT in Portland named Dr. Bobby Gahiri. I was able to go out and shadow him in Portland and see how he works. And then I did some tongue tie releases and sent him pictures for follow-up and said, hey, I would like you to look at these. Do these look fully released? How what do you think? And was able to get some feedback from him on his thoughts. I also worked with Dr. Kathy Leeper. She's a breastfeeding medicine physician in Omaha and has been doing posterior tie releases, I think, since 2005. And so I was able to spend 2 weeks in clinic and with her in Lincoln and Omaha, and saw how she did them and got very comfortable. She does scissors frenotomy, so I got very comfortable seeing those, diagnosing those, and treating.
Personally, that's the method I use as well, and I think that that's the easiest for parents to handle afterwards, because compared to the Plastibell, you don't have anything to deal with afterwards other than, making sure there's no adhesions and that the circumcision is healing well. So that's great that you're able to do that in the homes of your patients. I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. During this conversation, you and I have been with our kids in the same rooms. So I want to ask about how has it been after graduating residency, opening your practice, and having twins that are 7 months old, and your son, how has that been?
And not having a clinic, it's added an extra layer. So I've been able, since I haven't had a clinic, I've been home with my kids a lot more. My twins, I really haven't been away from them. So that's been interesting because I mean, with residency, you don't have that really. With my oldest, I started residency when he was 7 weeks old, and I was immediately on inpatient, and we were away from. So it's been really nice being home. So I've been able to have a really nice relationship with them and really get to bond with them. And then it's been great with my 3-year-old because I've been able to be home and he goes to daycare, or to preschool, but he goes for shorter days. So I've had more time with them. Balancing patient care and mom, and I just recently took my board exam. That has all been really interesting. Finding the time to do all of those things, to, feed the twins and to go on walks with my kids, and then make sure my patients are being well taken care of. Having this type of practice, I think it's easier than being in a fee-for-service practice because the growth is slow. You're not jumping into 30 patients a day. So I'm able to figure things out as they come instead of having to go home at the end of a long day and figure it out. So the balance has been really nice.
So important for people to hear, because mom, dad, parent, guardian, whoever is listening to this, I think that it is so important to just rehash how different a DPC model is versus fee-for-service, because I can't agree with you more. Being in fee-for-service currently, the idea of balancing what you have, including boards, it's just impossible. I can't even imagine that. So, thank you for sharing your experience. One of the things I love about your clinic is your social media presence. And I would really love to hear how you produce your content, specifically with this latest series that you've done on vaccinations.
I write about things that I see people talking about on mom groups, frequent questions that I get from patients, things that I wanted to know about as a new mom. So I don't have a whole lot of rhyme or reason to what I decide to post other than what is, I think, relevant and helpful. So how to have a safe Halloween, or, questions that I see a lot about, people thinking at 6 weeks, all of a sudden my baby's constipated whenever and so I can talk about infant dyschezia. And then most recently, there has been just a lot of talk with the Dr. Fauci coming and talking about the COVID vaccine and that what's coming, that a lot of people had been talking about it. And that started bringing up a lot of questions about vaccines in general. And, well, can we trust that this COVID vaccine is going to be safe because it's been rushed through? And how do we know what's in it? And all of those things. So it brought up a lot of questions about just vaccine safety. And vaccine hesitancy is something that has always been interesting to me. And I actually did my senior conference on it in residency because of my type of practice. I have this very unique practice where I don't have a waiting room full of kids and I don't have to split up a sick and well side. I'm not limited by insurance time restrictions for patients or for parent questions. So I did my conference on what should I do about patients that or parents that are hesitant about vaccines or maybe don't vaccinate at all. So I was able to do a lot of research on the most common concerns of autism, too many too soon. Are we overwhelming the system? What about formaldehyde? What about fetal cell DNA? All of those things that, rightfully sound terrifying, that we're injecting our kids with formaldehyde. Oh God, it sounds scary. So my goal was to provide unbiased, non-judgmental, just here's the evidence, here's the facts. And so that way parents can have hopefully a trusted resource where they can get this information of, this is what science says. So that was my goal with that. And I originally was going to do a topic. I post on Monday, Wednesday, Friday, and I was originally going to do a topic per post. Then I was like, man, it's going to take forever. And I have other things I want to talk about. So I just kind of lumped the last few together. So I was able to, it turned into quite a long blog post, but I was able to get everything out there that I wanted to talk about and then be able to move on and talk about other topics.
Yeah, and you've been very successful with that. I follow your posts on Instagram, and I go to your blog to read more. This latest one about Halloween, you're really touching on things that, like you said, you're in touch with your patient population and what your patient population is asking. So that's great. I want to ask about the fact that you are a pediatrician and an IBCLC. How did you find out about how you could become an IBCLC, and how did you train to become?
When I was pregnant with my son, I learned about a Facebook group called Dr. Milk, which is Doctor Mothers Interested in Lactation Knowledge, I believe is what it stands for. And it is, I think, over 20,000 physicians all over the world that were breastfeeding and have questions. And so I was able to peruse that while I was pregnant and able to post questions while I really struggled with breastfeeding my oldest. And it just developed this kind of passion in me to this is so hard and so many moms want to do it. We know that breastfeeding is so beneficial to moms and babies, and it has not only a medical but an economical impact. It is huge. And I want my patients to be able to have that assistance without having to see someone else. I want to be able to do it. I'm very much I want to do the things person. So I started with, I talked to our lactation consultant, and I looked on Dr. Milk because tons of doctors on there are also IBCLC. So I was able to see what they said. And I talked to one of our lactation consultants at KU, and she was fantastic in providing me resources and go to the IBCLE website. And she introduced me to Dr. Leeper and was just really helpful in determining how to become a lactation consultant. So you have to have 1,000 clinical hours and 90 educational hours specific to breastfeeding. And in pediatrics, the 1,000 hours were not that hard to get. How many times in my newborn well child checks do I talk about breastfeeding, or in the newborn nursery, or in the NICU, or even on my specialty months and when I was on renal, it's so many kids that are breastfeeding, and you talk about it all the time. You talk about their nutrition and how that is impactful. So I was able to get those hours very easily as just working as a physician. And the nice thing is, as a physician, you don't have to have anyone sign off on your hours. They're all self-reported. So I didn't have to make sure that someone's watching me provide this education. It was just part of my well child checks, and I was able to add that in. And then the 90 hours, I was able to get by doing different conferences. So like the Gold Lactation Learning, the IABLE, lots of different online conferences. I was able to do it all online, where you learn about breastfeeding and all of the things that go with it. The IABLE was started by Dr. Anna Glash, and it is probably the most relevant for physicians wanting to do it because it is physician led. So it is at the physician level. So you're able to get a deeper knowledge base and get into the diagnosis and treatment side of things, where IBCLCs can help with breastfeeding, but they're not supposed to really diagnose. So you get that deeper knowledge.
I'm actually really glad that you mentioned IABLE because coming up in January, I believe there's 2 Saturdays in a row that IABLE is offering an online course for physicians. That's $45 for physicians, and I think it's $20 for residents.
Yes.
But I definitely want our listeners to know that. So I'll put that at the bottom of your accompanying blog post, just because when I saw $45 versus like UC San Diego, UC Davis, their breastfeeding courses are like in the hundreds of dollars. And so to have that knowledge, even if you're not necessarily an IBCLC, or that you've had 1,000 hours, because I could see that being a little bit more difficult when you're in practice, and not doing, nursery rounds, etc. So that, we'll make sure that we include that information. But I'm really glad that you brought up IABLE. When a patient is looking to join your practice, or a family is looking to join your practice, you have a form that they complete through your website. And I wanted to ask about your decision and your thought process to use that type of form versus a direct enrollment form, like someone who might be using Atlas or a different format would have, where you're directly linked to the EMR. Here the recording gets cut off, and Dr. Hughes goes on to explain that she uses the EMR Charm for her practice.
Charm doesn't allow direct enrollment, which was the primary driving reason behind having a form. There wasn't another option. So I just my form includes all the information required from Charm for me to send a patient portal request. And so my patients, they fill that form out, and then they get an automatic email with how to enroll in how to sign up for their patient portal once I send them the request. So it allows me to also call them. They provide their phone number. So I'm able to give them a call and make sure they understand what they're signing up for, how my practice is different, that I don't bill insurance, that I recommend and follow the CDC vaccine schedule. And so it's able to get a lot of those questions out of the way prior to enrollment. And then they come to an appointment and we're like, oh, wait, actually, we're not a good fit. So it's able to be a nice screener for me as well.
You definitely have achieved that with the way that you've set it up and the way that you've asked the questions. I definitely invite people to visit your website just to check it out, because it's a way to get the job done, to help screen and to cut down your time, especially because you are running a micro practice. In terms of tech or tools, as a pediatrician, are there any specific things or products that you recommend for other pediatricians or other IBCLCs?
So I would say I like Meta Honey for nipple breakdown, instead of using like Apno or something that is a little bit, Apno, what am I treating? It kind of treats everything. So I like being able to direct my treatment. So Meta Honey is a really great for like cracks. And then I just use like topical mupirocin or whatever for any signs of infection. As a mom, I would say one of my favorite tools is the Nail Frida. It is great for clipping nails. And I've yet to see someone actually clip their child's skin using it.
And those are accessible to everybody. In terms of resources for learning about or opening a DPC,
don't reinvent the wheel. Ask the questions and know that most of the questions you've asked, someone has already asked. And you can find a ton of information that is just really, really helpful. So I would say that is probably the biggest resource for starting a direct primary care, is DPC docs, because there's checklists of how, okay, you need to apply for a business license and like those sorts of things. And it tells you how to do them.
For those who are considering incorporating pediatrics in their practice, or who are coming out of residency, what would you tell them to inspire them about DPC?
It's scary to do it right out of residency. It is scary to start a practice with a family. But the trust that develops between you and your patients is it's incredible. It's such a very noble thing. And it's, we all, as college students, why do you want to be a doctor? I want to help people. Well, this is how you do it. You really provide care. Like, this goes back to who I was as a 22-year-old applying to med school. This is it. This is what I imagine. It's this where I can sit and talk to patients and really get to know them. And I don't have to leave myself notes reminding me who they are. I know them. And it's a really incredible way to practice.
Thank you so much for joining us today, Dr. Hughes. It's been inspirational talking with you. For those who are listening and who may want to reach out to you after the podcast, what's the best way for them to reach you?
Email me. My information's on my website, bloomdpc.com. DPC is in direct primary care. Or they can email me at Dr. Hughes at bloomdpc.com, doctor with a DR.
Next week, look forward to hearing from Dr. Deanna Gurnita of Rheumatology on Call. Until then, this is Marielle Concepcion. For more information on this episode and much more, please visit mydpcstory.wixsite.com/my site. That's mydpcstory.wixsite.com/MYSITE.